A very exciting show for you guys today. So we have Dr. Ferrara. He's going to play a little small amount for us on the guitar.
Intro.
A little intro.
Well, we're at our home studio today, literally our home studio.
So we are at our complex today, and so we're happy you guys are joining us today. And we have a very exciting topic for you guys today. Our topic is, what are the early symptoms of the flu? That's what we're going to talk about today. So
and also the flu going around, and given its continuation of last week, basically. So today we're in-house because of the weather, snowbound. Although I wish I was in Florida over the weekend playing soccer.
Absolutely.
And not only did I get to play soccer, but I got to hear some great music. We ended up going to an Irish bar and had some music and dessert there.
Okay.
So that was pretty nice. But
so what are some of the early symptoms
of the flu?
Right.
That's a good question. I want to share this.
Oh, absolutely. Please do. If you guys are watching this, please share this on your Facebook page, because we're going to give out a lot of good information today, just like we did last time.
Yep.
A lot of people really shared this Facebook page.
Yes.
So please share this Facebook page.
It's officially, let's talk about flu. The flu is officially as an epidemic right now, which means all across the country, everybody's seeing. Usually waves from the West Coast, it goes to the East, but they're seeing it in California, they're seeing it here in the Atlantic Ocean side. So it is really affecting the country, and part of it is because of all the holiday travel that happened, and it spread like, I guess they say, wildfire. And so the flu is really hitting this country hard. But having said that, even though it's an epidemic, I don't think it is, even CNN, I was reading New York Times articles, it's not really time for hysteria. Everybody is fairly well. I know you get the occasional stories where somebody healthy had died, and some of the statistics give you an idea, about 0.023% of the people who are affected by it are hospitalized.
Wow.
Doesn't mean they get some bad outcome come. So overall, you can get through this, and basically part of this is to reassure people that, hey, everybody's doing well from what we've been seeing. Yes, you need supportive care. The main thing is you want to see your doctor. One is confirm that you have the flu or not, but to make sure you don't have something else. Because the ones we've been seeing complications, they end up with pneumonias, or you think you have the flu, it's a pneumonia or something else. But go ahead now, ask the question.
So what are some of the early symptoms? Because sometimes people may catch a cold and they may have the flu. So what are some of what's really kind of the difference, as far as the symptoms between the cold and the flu? And I think people really want to hear this.
So the cold, pretty much you think it's upper respiratory infection. What people usually common say, the cold, it's from up here, and you might have the lungs, a little bit of cough. So it's runny nose, sniffles, sore throat, coughing, things like that. I think you get that with the flu, but overall, mainly what separates the flu is that you get a higher fever, so you get fever, and you get body aches. And I'm talking about just the arm or the shoulder or the neck or the headache. I'm talking about the whole body, your muscle aches. And the best way people I've described when I've had it, is basically being run over by a truck. You just feel like you just got done with a marathon and you just hurts.
I see.
And that's basically what distinguishes the flu, is the body aches, I think.
I see.
In my mind.
And so what are some of the early symptoms of it? I mean, what are some of the things that, is that body ache, is that just one symptom, would you say?
I think the one symptom is you're feeling well. 1 second, you wake up in the morning, you're feeling well, and then about 2 hours later, after lunch, all of a sudden you feel like something's not right. You're starting to get a little bit the chill, a little bit achy, and then the runny nose. I think it's quite as a rapid onset as opposed to other things where I just had a little bit of a scratchy throat for a day, and then I had a runny nose, and then develops an upper respiratory infection. I think comes on fairly quickly.
Okay.
But overall, and this has not changed from the first time it's been described back literally over 1,000 years ago, is that it lasts from beginning to the end, no matter how you slice it, how you dice it, 7 days.
Okay.
The first 2 or 3 days are the worst, and after that, you're recovering.
So when you say like 7 days, because some people I've heard, they said theirs lasted for like 2 weeks or something like that. Was it symptoms that they
Probably
had
symptoms,
afterward, but not the actual flu?
Or they developed other complications from it, or they got hit with 2 viruses at the same time.
Okay.
I mean, I've seen people develop ear infection, so sinus infections or pneumonias. strep from it, but a lot of times, usually if it lasts 2 or 3 weeks, usually it's not the flu.
Okay, I
Or they
see.
have something else on top of it, a comorbidity.
I see. I see. So if you guys are interested, please put your comments up there. Were you able to share that on your page as well?
Yes, I was. Any
Okay,
comments
good.
yet?
Put your comments up there, and hopefully we'll be able to answer any of your questions out there as well. If you could share that on mine as well, just because for some odd reason I can't share it on mine. So,
So share, how do I do this?
but yeah, we'll go ahead
Share
and I'll
to
do
a
it for
page,
you.
Dexter.
Yeah, and so, but guys, this is what we're talking about here today because this is like so huge. Like everybody's talking about the flu right now. I mean, it's always on TV, like in the evening news and things like that. And so we wanted to bring it to you guys so you guys could see and hear directly from Dr. Ferrara some of the symptoms that at least the beginnings of the flu brings, because a lot of times people, like I said, they feel like a cold is the flu, and it's
Yep.
not. So
It's not.
I think people need to understand exactly what are the early symptoms of what the flu is.
And if you get exposed to it, it's usually about a week later that you develop the symptoms, not 2 or 3 days later. The best way is you hear about the flu going around your office as somebody, it's always best prevention is staying away from those people because it's spread by cough and just sneezing, droplets being spread in the air. So if you're in a room, you happen to catch it, you're going to hit with that virus.
So now that's another good question. Like, so for example, does it spread pretty quickly?
Yes.
Okay. Like,
It spread very quickly, so that's why it's important to wash your hands when you cough. You know, you cough into a tissue or sneeze, blow your nose into a tissue. That actually does prevent. Always cover yourself. Cough into a tissue if you are going around. But basic best prevention is really the flu vaccine. There's actual New York Times article I saw today regarding that. Maybe we'll share that in our Facebook page. And definitely, I think the most informative I've seen so far is CNN actually had another article today on that informs about the flu and basically reiterated what we are talking about, the symptoms, but also if you do get treatment is what we talked about last week, which is basically rest, lots of fluids and fluids and fluids and fluids and fluids. And I'm not talking about water. Things that vitamin C juices, Gatorade, and Tylenol and Advil. Do those 4 things, you're going to feel 100 times better. And I know people always ask about Tamiflu, a flu test. And my feeling on it is that even that article in the CDC reiterated today, it's basically for severe cases and for those who are at the highest group at risks to develop complications, which are basically neonatal children, children that have other diseases and elderly who are very ill.
I see. Now, when you say, because I had also read too that like the 65-year-old crowd and higher, they're really getting hit hard right now. And so if you're out there and you're 65 years or older, you need to hear Dr. Ferrara and hear what he has to say about. So how can somebody who's older help prevent some of these things as far as some of these issues that they're that right now?
Vaccine is the best thing. And I know I'm going to get, last time, emails and calls from the anti-vaxxers, but vaccine is really the best way to prevent this and has saved lives. Right now, they say annually, not in the United States, and so many, I forgot, I think 500, was it 500,000 deaths, but almost all of them came in places where people were not vaccinated. So vaccines does help. Yes, there are some people who are resistant to it, or they have gotten the vaccine and they got the flu, but I tell you, in those situations, the flu has been very mild, like lasted a couple of days and they were fine.
Wow, and Leslie said, and it's not too late to get a vaccine. And Elizabeth says, I'm hearing that the flu shot is not that effective this year. Only 10% of people who got the vaccine ended up getting the flu, only 10%.
No, I think it is been effective. So she's saying 10% of people still get the flu, and that's probably about right, Elizabeth. Every year, it's about 10% who get the shot still end up getting the flu. But the ones that, like I said, who get it, Elizabeth, it comes back in a much minor form. So vaccine, think about it, 90% means are protected. I'll give you an idea. We have our health workers, not only my clinic, but I think other clinics, we get vaccinated, and we've been bombarded with influenza since about November, and none of us have been ill with the flu.
I see.
And I'm constantly been exposed. Actually, Lee, I can say hundreds of patients have come in over the past week, and I'm still standing here without it. You have me here as testament that the vaccine does work.
I see. So if you guys are watching right now, what we're talking about are early symptoms or early signs of the flu, because like I said, a lot of times people feel like if they have a cold or if they're sneezing, They may get a little bit nervous and say, hey, I think I have the flu, and it may or may not be. So that's why you need to go see doctors like Dr. Farrar just to kind of get that information out and see exactly what's going on with your body. I think a lot of times people want to, you know, when you catch a cold or something like that, you don't want to go see a doctor immediately because you say, well, this will go away over the next day or two, and then it gets worse.
And I think you want to go see to see a doctor to confirm what your suspicions are. The main thing, make sure you don't have something else. You know, are flu tests always necessary? I don't think so. Or is Tamiflu? Tamiflu, my opinion, it's only, like I said, for severe cases and for those who are in the higher risk groups, the elderly with diseases. Everything else, let's say, the Tamiflu really does not shorten the course from 7 days. You really not, if you're having mild symptoms, you're really not going to notice the difference. You're going to feel like most people spend about several $100s, because most insurances don't cover it, and you really haven't noticed the difference at all. And but if I'm telling you what makes a difference is fluids, and I'll say it over and over again, fluids, rest, Tylenol, and Advil, those 4 things. And overall know that, yes, you're going to feel sick, but at the end of the day, you're going to be okay. Everybody's going to get through this. And I would give it another couple of weeks, but I think by, I would say, but for sure mid-February, I think most of the cases should be gone. I think the main virus is called this year, they're calling it H3N2 virus, which this year's vaccine does cover that.
Okay, I see. And so if you guys are watching right now, please put your questions up there for Dr. Farrar to answer your questions about this, because this is so huge right now, and a lot of people, you know, respond.
The whole country.
Absolutely, the entire country.
We had a lot of shares from our last Facebook web live, and people had lots of questions on it.
Absolutely.
And it was great. It's amazing that even I think United Insurance, they thought it was useful information that we put on, and they got an email thanking us.
Wow, okay.
For putting that information.
Say that one
out.
more time. We need to hear that
United
again.
Health Insurance. I got a thank you email from one of their executives and said, hey man, this was great to put information out like that to the public.
Wow.
Yep.
So that's great. They're watching us.
They're watching.
Good. Absolutely.
They're watching.
United Healthcare. Hey, shout out to United Healthcare. So this is exciting, guys. This is what we're talking about. We're trying to put out information to help you guys understand some of the symptoms that you may have, especially early symptoms, because like I said, you may have sniffles, and you may say, oh, this is maybe just a cold, and there may be other signs that it may be a little bit more than a cold, and that's why, like I said, we're talking about this today as far as some of the other issues there. Now, who typically gets affected the worst?
The worst ones would be elderly patients. I would say, when I mean elderly, and this is no offense to our senior citizens, because I'm almost there. I'm talking about 80, 90-year-olds who are in a nursing home, usually in assisted living facility, because that tends to spread in those areas that are hospitalized, who have some serious comorbidity illness. That's who are affected the most. And also children who are under 3 months old and who have already some other existing diseases going on. But the elderly are affected the most from this.
I see.
Because it takes a lot of energy for the body to mount the autoimmune response. Our bodies take care of this virus very well genetically. Our antibodies have evolved very, very well in fighting the influenza virus. So what you're feeling, when you're feeling the aches and the shakes and the fever and the sniffles and body aches, that's really to me, I look at it as a good thing. That tells me your body is very healthy. That is your body mounting an immune response to that virus, and is doing a great job in fighting it off, because that's exactly what it's supposed to do. And the way you feel better is by getting energy to fight that. And that's why you're drinking the juices, the vitamin C, the chicken soup, which I recommend, and Tylenol and Advil. It really does help.
Yeah, and last time you mentioned something that was really important that a lot of people, I think, took note of when you said that basically when we catch a fever or when we have a fever or we're kind of running pretty hot and we feel pretty hot, that's a good thing. Our body.
It is a good thing.
And you gave an example of something like boiling something.
Water. So if you think about it, if you want to sterilize, when what was it, DeKalb County, some pipe broke, and how do they say to sterilize the waters, to boil it? And the same thing, the body does the same thing, it raises, it has this innate ability genetically. I mean, if you think about it, just knows to raise your temperature and has the ability to cause a raise in temperature to basically destroy the viruses wherever is in us. and whatever's in our blood system, and just to kill it that way. And that's a huge defense.
I see.
That's why you feel it early on. It recognizes that you're being attacked, and immediately mounts a response. And this is going on all the time. It's not just with influenza. Viruses are hitting us all the time. You don't notice. Every day they're hitting us. Your body does just a great job. As soon as it hits, boom, eliminates it.
Wow, so that's what those fevers are. And it's kind of like I said, it stuck out in my mind. It's just kind of like boiling water to actually purify it.
Yep.
You know, so when your temperature is actually going up higher like that, it's actually like purifying issues that you have
The
inside
only,
your body.
no, literally, Dr. Sick, the only reason Tylenol and Advil is given to lower the temperature, the only reason is to make you feel better.
Okay.
It's not because fever is bad. And I think I said it last week, and I said it before. I've never ever seen a patient die or have any consequences from a fever, no matter how high it is.
I see.
Yes, kids do get seizures, but there's no long-term effect. Nobody's ever died from it, had any brain damage.
Wow.
Or anything like that.
I've never heard anything like that
Yeah,
before.
and that's something you can get. Heat stroke, which is your body temperature goes above 105, 106. That is different though than a fever.
Right.
That is totally different story.
Right.
But as far as an immunological response of your body having a fever, that's actually a good thing. With people, the same thing in lymph nodes. They say my lymph nodes hurts, and they do. And that's one way to judge. That tells me your immune system is working well.
Wow.
Your body is doing what's designed to do.
That's some awesome information. So if you guys are watching right now, if you want to put your questions up there, Dr. Ferrara usually gets back with people pretty quickly. Even after we're not live, he usually gets back with people if they make a comment up there. So please, Linda says, hi, Doc.
Which Linda is that?
Right now,
Hi, Linda.
we are here talking about some early symptoms of the flu. And so if you guys are watching this right now, please put your comments up there. And Dr. Ferrara is here to answer any questions you may have, because like I said, this is something that a lot of people, millions of people across the United States right now are facing right now. So please put your comments up there, and we'd love to hear some of the things that you guys are talking about there. So please put your comments up there, and we'd love to hear it. And so thank you guys so much for watching. And can you also tell us about, what you said we're kind of coming to the end of the flu season right now?
Yeah, I think.
When does that end typically?
Usually ends around mid-February. Right now we're at its peak. I think we're going to see one more week of peak, and then it's going to slowly, gradually go down. We're right now at a peak, and it varies when the peak goes. This time we're seeing it. This time I think it's because of the holidays. And one of the things I'm reading, another message I'm reading across the country, that our hospital emergency rooms have been inundated with, especially Grady in Atlanta, but overall across the country, my colleagues are telling me just a lot of people are going there with the flu, and it's overwhelming the emergency rooms, not because people are sick, people are just using the emergency rooms as a doctor's office, I think. And many hospitals are going on divert, which means patients are really truly need to be seen and not being seen.
I see.
Or they're being boarded, not being seen on time. And my public announcement right now is basically, hey, if you think you have the flu and you want to be checked, unless you really feel like, hey, you're having a pneumonia, you're short of breath, and any symptoms, I think this is just worse than the flu. Other than that, just feel bad. It's okay to go see, an urgent care, see your doctor. It's just to give the emergency room a little bit of a break so that that the sick ones can really be seen. I mean, I'm not saying I'm not discouraging you from going to the emergency room, but just be mindful of that.
I see.
Plus, as you know, going to a doctor's office or an urgent care, I mean, the cost is like astronomically thousands and thousands of dollars less. I mean, you go for flu to do flu test, and you get seen there, and you get Tamiflu. You're looking at about a $1,200 to, depending on the hospital, sometimes $2,000 cost.
Wow.
Going to an urgent care, at least by us, we have this thing called low flat rate. So you averages around $130, no matter what. That's what the fee is. In other places, I know it's much higher. But either case, it's much less than the emergency room.
Absolutely. And I know, like you had mentioned before, I had met Dr. Ferrara maybe I think about a year ago. I was dehydrated and I didn't know it. So I said something's not right. My head was hurting, and I just was feeling like I was going to fall out. And I was driving down the street, and I said I have to go over to urgent care at Peachtree. Your location, urgent care at Peachtree.
Here in Buckhead.
And so I went over to Dr. Ferrara, and he put me on IV. The one thing that you guys have, a lot of people like going to your urgent care because you guys are so fast. everybody talks about that. You get in there and you get out of there, and that's one thing that I really like about your saying. One of the things that also we noticed, I think you said you don't have any TVs in there, so because they don't want you in there long, right? In the waiting room.
No, I always have this philosophy: if you have time to watch TV or read a magazine, then we're not doing our job. Although I have to admit, the last few days, because of the flu, our waiting time has gone a little bit up. So I think our patients yesterday were waiting, I think the most, was 40 minutes, but an average is about 30 minutes, which is still a lot for us. We don't like anybody waiting.
I think when I came to see you guys, it was like maybe 10 minutes, and I was in and out. I mean, it was crazy.
Always takes longer with us to fill out the paperwork than it does to be seen. Exactly. That's what I always say. But I think, it doesn't have to be my urgent care, just any urgent cares or what I call retail clinics, medic clinic, just so that way the emergency room doctors across the, sorry we get some background noise, but across the country are not being innovated because a lot of sick patients are being missed, and I would hate that anybody have some consequences because they really are sick. They look at the emergency room and they say, "Oh, I'm leaving," when they really need to be seen.
Absolutely, definitely.
And ambulances and things and stuff.
Absolutely. So this is what we're talking about here today. For you guys who are just now joining us, we're discussing about what are some of the symptoms of the flu. And so excuse our background noise. We're in an open area here, so it's a little bit noisy. But thank you guys so much for tuning in. And if you guys have any questions, please feel free. Lynn, thank you so much for joining us. Rossi, thank you so much for joining us.
No, that's Rosanna.
Rosanna.
Rosanna is actually, I'm going to give a shout out to her.
Okay.
Ciao Rosanna, spero che tutto bene in Sardegna lì. She's from the island of Sardinia. I think that is God's place on earth. It is one of the most, probably the best kept secret in Europe.
Wow.
It is absolutely, it looks like a Pacific island going to Tahiti. It is not yet discovered.
Wow.
It is fairly isolated, great hotels, great food, amazing people.
Wow.
The beaches are like nothing you've ever seen in Europe. Real beaches with sand. So I want to say hello to my friends in Musei, Cagliari, and I miss you guys, and ci vediamo presto.
All right, so you guys heard it. So we're pretty much wrapping today's session up. So do you have any parting suggestions or anything?
Ciao, Roseanne. That's Roseanne is joined in also.
Oh, Roseanne.
I see ciao from.
Yeah.
I love it.
Awesome. So if you have any parting words, if not, then we'll play our exit music, and you'll give us a little. We usually play a little exit music.
Oh, you want exit music? I'll do the same thing.
Since we're not in our normal place,
but Dr.
Ferraro's he's going to play his little exit music. So here he goes. Thank you guys so much for watching. Here we go.
You can email what song this is.
There it is. All right, guys. Thank you so much for watching. This was fun. This is our music session.
Stay warm and stay healthy.
Thank you guys so much for watching. And please share this on your Facebook page as well, because it's a lot of great information that was shared today. So, all right. We will talk to you guys later. Thank you so much. Appreciate it.